Namaskar, I am Dr. Parul Sharma, Director, Max Eye Care, Max Hospitals, Delhi and Gurgaon. Today we will be talking about the most common topic in children, which is an eyesight problem, early detection of that problem and how to take care of it. So let's start by understanding why do we even have spectacle powers or refractive errors in children. Now, unlike what parents think that it could be a diet deficiency or it's just the screen which is a problem, no. The spectacle powers come onto a child because of a difference in the optics. The way we all vary, the way we all have different organs, dimensions. Similarly, in the eye, there are three optics which influence the spectacle power. The front portion of your eye, the mirror-like portion which is the cornea, that a natural lens inside the eye and the length of the eyeball. These three areas of the eyeball make sure that the image which you see, the outside world, falls on the retina. That's the back layer of the eye. Now, when image is not formed on the retina, the child sees blur. This could be because of a change in the corneal curvature or the lens or the length of the eyeball. We give spectacle power, which could be a concave minus lens or a convex plus lens or a cylindrical lens which is on a particular axis to shift this image onto the retina so that a child starts seeing clearly. So, the lazy eye or amblyopia, basically it's a misnomer. The eye is not lazy, but the brain area, the occipital cortex from where the image is getting processed, that part is lazy because the brain has not seen a clear image till now. The child had a refractive error, he's not been wearing spectacles, so it's a blur image. The brain recognizes that blur image to be the normal image. As a result, when we give spectacles also, the vision does not improve to 6 by 6 or 20 by 20, and that is what is called as amblyopia or a lazy eye. The squint or the deviation of eye, where one eye could be straight, focusing straight, and the other could move inwards or outwards, is related to the muscle tone, or it could also be related to spectacle powers. Sometimes we have congenital squint, which means that a child is born with this kind of imbalance, or it can happen over a period of time secondary to any kind of diseases, systemic illnesses like viral diseases or neurological problems. Sometimes children start going very close to the television to watch it, or they would hold their objects or books very close to the eye. Some children also make a slit or they squint when they want to see something far object. That's an indication that the child could be having a blurred vision. There could be a little tilt in the head posture, or they could be squinting their eyes, as I said. Also, some children complain of headache, pain in the eyes, or the parents can see that the child is excessively rubbing the eyes trying to focus better, or they could be watering of the eyes. A common complaint which is missed often by school teacher is that the child is not concentrating or performing well, and it could very well be a vision problem in the child which is undetected. So these are all symptoms which a parent should watch out for in their children. Now, if you see any of the problems in your child which we have enumerated earlier, like squinting eye or keeping a head tilt while looking at objects. So those kind of children with constant watering of the eyes or they are rubbing their eyes, then even a few-month-old baby has to be taken for an eye examination. The second situation is your child doesn't have a vision problem. You don't think there is a problem. Even then, many a times the refractive errors go undetected, and that is why at the preschool age, at the age of 3, when the child is able to recognize some alphabets or can respond to images being shown to him, is the right time for the first eye checkup to be done by an eye doctor. If you detect a vision problem in your child, then you have to take them to an eye doctor, ophthalmologist, who will check the vision, whatever may be the age of the child. I mean, we have our ways to check their eyesight and their eyeball even when they are few months old. So the ophthalmologist or the eye doctor is your contact person. There is a trend of myopia being increased in all the urban cities, which we see so many children wearing spectacles, and the parents are quite concerned about that. Usually the blame goes on more screen time or some kind of diet deficiency. It's a mixed thing. Actually, the myopia or the minus number is mainly related to the optics of the eye, which is primarily the length of the eyeball, and then of course the corneal curvature or the lens accommodation can also affect myopia. But by and large, it's your own genetic pattern or your own chromosome patterns which defines the length of the eyeball or the optics of the eyeball. My advice to them is make it a fun activity, make it a family activity. There has to be a positive reinforcement about your child wearing spectacles. They go to school, they are at a tentative age, they should not feel that there is anything less with them. So go out, shop for the frame together. Let it be a child's choice, the color, the cartoon frames that they can wear. They feel good about it. For refractive errors, in children, the treatment is only spectacles. When they reach their teens, they have an option of switching to contact lenses. It could either be spectacles and contact lenses. And post 18 or 19, we have refractive procedures like lasers to decrease our dependence on glasses or to get rid of glasses. The treatment for amblyopia or lazy eye is to basically stimulate the occipital cortex of the brain, the part of the brain which is making a child see. It's lazy, so we have to stimulate it. Now, how do we stimulate it? Is if the child has an imbalance in both the eyes, one is a better eye and the other is a lazy eye, we patch or occlude the better eye so that the child is forced to see with the lazy side of the eye and brain with the spectacles, and that in itself is a stimulation for the brain to process the image better. The treatment of squint depends on the type of the squint and the stage of the squint. Sometimes it could just be a pseudo squint, which is not a real squint, and at that time we wait and watch out, and most of the time as the child is growing and the eyes are getting aligned, they autocorrect by itself. There is a category of squint which is accommodative squint, which is related to spectacle power, and in those children we give the right spectacle power, and that in itself is a treatment of the squint. The third category is the muscle imbalance. So this category needs surgical correction where we operate on the muscles, align them so that the eyes are straight and the child can enjoy binocular vision and completely well aligned eyes. So now that you know what all causes vision problems in your children, you know the solution, it's very important to go for regular follow-ups with your ophthalmologist. So for a child it could be 6 monthly or a yearly follow-up, because children are growing. So their eyeball is also changing, the optics are changing, the spectacles need to be updated. So follow your doctor's advice, and wish you all a happy eyesight and a happy vision for you and your family.